I am inviting Dr. Ringal Deva to moderate today's English session.
Am I audible, sir?
Yes, everything fine. You can go ahead.
Okay. Shall I start, sir?
Yes.
Yes, yes. A very good evening to respected dignitaries, senior doctors, teachers, colleagues, students, and all the participants joining us from the different parts of the India across the world. A very warm welcome to each one of you to the 2049th day of the uninterrupted daily webinar organized by the International Forum for Promoting Homeopathy, IFPH. IFPH is a unique international humanitarian organization dedicated to promoting homeopathy by bridging together homeopathic professionals and enthusiasts under the one umbrella. Beyond regional, religious, political, and ideological differences, it is truly inspiring to the witness this remarkable journey of more than 2149 consecutive days of the knowledge sharing. In today's session, focuses on a very important topic, that is the menopause beyond the hot flushes, homeopathic approach to the woman's midlife health. So, the menopause is not merely the end of the menstruation, it is a significant transition in a woman's life that affects her physical, emotional, hormonal, and social well being. Through today's session, we hope to gain valuable insights into understanding menopause from a holistic perspective and learn how homeopathy can help a woman to navigate this important phase with a confidence and better quality of life. It is now my privilege to introduce today's speaker, Dr. Hardi Malani, currently serving as a medical officer at Sainath Homeopathic Hospital, Rajkot Homeopathic Medical College, Parul University, Gujarat. Dr. Hardi has been actively involved in a patient care and passionate about the homeopathic practice. We are delighted to have Dr. Hardi with us this evening to share a valuable clinical experience and knowledge. On behalf of the International Forum for Promoting Homeopathy IFPH, I extend a warm welcome to Dr. Hardi Malani. Ma'am, thank you for accepting our invitation. The virtual stage is now yours.
Am I audible to everyone?
Yes,
Hello.
audible and visible. Everything fine.
Okay. Good evening, everyone. So, I am Dr. Hardi Malani, a BHMS graduate and currently working as a medical officer at Sainath Homeopathic Hospital, affiliated by Rajkot Homeopathic Medical College by Parul University. It is privilege and an honor to invited by the IFPH as today's guest speaker, and I sincerely thank the organizer for giving me this opportunity to share my thoughts on an important aspect of women's health. And special thanks to Dr. H.N. Mehta sir and Dr. Panda sir for giving this kind of opportunity. Thank you. So my today's topic, menopause beyond hot flushes, homeopathic approach to women's midlife. I share my slide. Is it visible?
Yes. Everything fine. You can make it full screen. Yes, fine.
Menopause and homeopathy, natural relief through holistic. Menopause is one of the most critical biological transitions in women's life, while modern medicine frequently views menopause through a purely hormonal replacement lens. Homeopathy approaches it as a natural physiological evolution. Our goal as a homeopathic practitioner is not to provide the body's innate physiology, but to harmonize the vital force during this phase of endocrine recalibration. So today, we will explore the clinical landscape of menopause and its long-term physiological impact, homeopathic prescribing principles, individual remedy profiles, and a real-world clinical case study. Objectives. To guide our lecture today, we have established several key educational objectives. Foundational understanding, review the clinical definition, epidemiological variation, physiological stages of menopause, symptomatology and pathology, map out the systemic manifestation and long-term health consequences resulting in estrogen withdrawal. Homeopathic application like understand how organal principles apply to the menopausal transition, selecting individualized remedies using the totality of symptoms. Clinical case analysis. We walk through a comprehensive clinical case from case taking, rubrication, and prescribing a long-term follow-up management. Introduction. Menopause is the kind of menstruation. Menopause derived from the Greek word. The word menopause derived from the Greek word mens.
Doctor, can you speak a little more louder, or please sit a little more closer, so that we will get.
Okay.
Now it's clear.
The word menopause derived from the Greek word mens, meaning monthly, and poses, meaning cessation. Menopause is a part of woman's natural aging process. Her ovaries produce lower level of estrogen progesterone, and when she no longer able to being pregnant. Physiologically, menopause represents the natural age-related decline of ovarian follicular activity as the ovarian reserves depletes. The production of primary steroid hormones, specifically estrogen and progesterone, drops significantly. This decline permanently closes the reproductive window. So now she is no longer able to become pregnant. It is vital to emphasize to patients that menopause is not a disease state. It is a normal developmental landmark. As WHO says, menopause is defined as the permanent cessation of menstruation resulting from the loss of ovarian follicular activity. From a diagnosis perspective, menopause is always a retrospective diagnosis. A clinician cannot definitively state that a woman has reached menopause until she has experienced 12 consecutive months of amenorrhea without any underlying medical condition, such as thyroid dysfunction or hyperprolactinemia, or physiological states such as pregnancy. Epidemiology. Average age of menopause in our country is around 51. Looking at global data, the average age of menopause is approximately 51 years, with 95% of women undergoing the transition between 45 to 55 years. The perimenopausal shift generally begins 4 years prior to the final menstrual period. Epidemiological studies reveal notable demographic variation. Early premature and early menopause more frequent in Black and Hispanic women than in among the white population. In India, the average age is slightly lower at 46 years. This earlier onset in Indian women is influenced by genetic, nutritional, socioeconomic, and lifestyle factors. These are the stages of menopause. The menopausal spectrum is divided into the 4 distinct stages: premenopause, perimenopause, menopause, and postmenopause. Premenopause spans from menarche puberty through the mid-40s. During this stage, regular ovulatory cycles take place, driven by balanced hypothalamic pituitary ovarian axis feedback. There are no menopausal symptoms during this phase, as it represents the peak reproductive years of woman's life. Premenopause is from puberty to mid-40s. Perimenopause. Perimenopause is the dynamic transition phase. Hormonal levels do not simply shut down here, they fluctuate widely. Anovulatory cycles cause progesterone levels to drop and estrogen levels spike unpredictably before decline. Clinically, we divided perimenopause into two types. One is early perimenopause and second is late perimenopause. In early perimenopause, cycle length variability of 7 or more days between consecutive cycles. In late perimenopause, marked by an intermenstrual interval of 60 or more days. Patients during this stage present with physical complaints like hot flushes, sleep disturbances, menstrual irregularities like flooding or scanty flow, or emotional sensitivity like mood swings. Menopause. After 40s, menopause occurs in months. 12 full months of amenorrhea have elapsed. Uh, the point of menopause is officially reached. Endocrinologically, the lack of estrogen negative feedback causes the anterior pituitary to secrete high levels of FS. Postmenopause covers the entire lifespan following menopause. The first 5 to 8 years of postmenopause are known as early postmenopause. During this phase, systemic adaptations occur. During this phase, women remain at risk of acute estrogen deficiency symptoms such as long-term tissue changes like osteoporosis, cardiovascular disease. As women have to going through menopause like that, men also have andropause. It is not much popular topic of discussion in our society. Clinical picture of menopause spans multiple body system because estrogen receptors are located throughout the body, including the brain, vascular endothelium, skin, bone, and bladder. Some physiological symptoms like wet chest, hair loss, melasma, brittle nails, vaginal dryness, dyspareunia, lip disorder, dizziness, some allergies. In some cases, we also see vitiligo after menopause, headache, breast pain, osteoporosis, system symptoms like tingling sensation in body or fulmination, numbness, vasomotor symptoms like changes in body odors, hot flashes, and night sweats. Patient also suffers with ringing in ears, weeping tendencies, burning in mouth, or apathy without any reason. How a woman's body changes post-menopause. They feel some nutrition deficiency because of digestive issues, loss of mass, reduced metabolism, reduced estrogen, increased risk of osteoporosis and cardiovascular disease. Surgical management. The ovaries produce estrogen, progesterone, androgen, which are essential for menstruation. It is essential to distinguish natural menopause from surgical menopause. When a woman undergoes a bilateral hysterectomy or a hysterectomy, hormone levels drop abruptly overnight. Unlike natural menopause, where ovarian decline is gradual, surgical menopause triggers intense immediate vasomotor instability, severe psychological distress, and rapid bone loss. These patients require close monitoring and thoughtful homeopathic management. In these cases, menopausal symptoms are more severe, more frequent, and last longer compared to natural menopause. Patient suffers many years after surgical menopause. Diagnosing menopause is primarily clinical and grounded in history taking. Routine hormonal blood tests are generally not required for typical presentation in women over 45 years. However, in cases of premenorrhea, confusing perimenopausal patterns, ordering serum FSH, serum estradiol, and TSH levels, confirm ovarian failure, and exclude thyroid pathology. These are some long-term health consequences after menopause. The physiological consequences of long-term estrogen deficiency extend beyond the temporary hot flashes. Osteoporosis. Estrogen inhibits osteoclasts, mediate bone resorption. Without it, women can lose up to 20% of their bone density in first 5 to 7 years post-menopause. Second, cardiovascular disease. Estrogen maintains vascular compliance and healthy lipid profiles like HDL and low LDL. Post-menopause, a woman's cardiovascular risk quickly aligns with that of men. Urinary incontinence. As the tissue of your vagina and urethra lose elasticity, you may experience frequent, sudden, strong urges to urinate and followed involuntary loss of urine. Sexual symptoms. Vaginal dryness, plasticity causes pain, dysphoria, body weight changes. Many women gain weight during menopausal transition after menopause because of slow metabolism. Menopause in homeopathy, we do not view menopause as a deficiency disease requires synthetic hormone replacement. Menopause management. Menopause management aims to relieve symptoms, improve quality of life, prevent long-term complications. Lifestyle modifications like regular physical exercise, or yoga, or some meditation, or healthy good sleep, healthy balanced diet rich in calcium and vitamin D to prevent osteoporosis, maintain healthy body weight. It also advised to patients to avoid smoking and alcohol. These are lifestyle changes we advise to patients during menopause. So now we start with homeopathic point of view. From a homeopathic perspective, menopause viewed as a natural transition rather than homeopathy aims to treat person as a whole, taking into account the physical symptoms, emotional state, personality, overall constitution. Goal is to support the body's self-regulatory system, selecting a remedy that matches the person's uniqueness. These are few remedies to his menopause. Conium, Durex, Sulfur, Zipuga, Lachesis, Pulsatilla, Sanguinaria, Canadensis, Calcaria car, and many more. Now, start on problems at menopause. Cold sweats. Here, patients have sweat day and night as soon as one sleeps or even closes the eyes. Mammary glands are lax, shrunken, hard, painful to touch. Want to press the breast, hard with hand. Weakness of body and mind, trembling, palpitation. Other is Murex purpura. Persons of melancholic temperament for the sufferings during climate, great depression of spirit, violent excitement in sexual organs, and excessive desire for an embrace. Bearing down sensation of internal organs. Patient must sit with crossed legs to ameliorate stress. Leukorrhea. Aggravation by mental depression. This is specific for murex. Patient is happier when leukorrhea is worse. Another remedy is sulfur. Persons of scrofulous diseases, total congestion, quick temper, plethoric, sensitive skin with bathing, aversion to stoop shoulders, too lazy, unhappy to live, congestion to single part of body, onset of tumors or malignant tumors mainly at climate, sensation of burning in body with hot flushes, nightly suffocating headaches, which is amyloidation in open air. Semicircular, also known as FTRS, useful in rheumatic nervous person with ovarian irritation, uterine cramps, and heavy limbs, pains like electric shock, and migraine, great depression, mania following disappearance of neuralgia, inflammatory pain, worse on left side, and angina pectoris. Yeah, resinosa is very beautiful remedy for all women complaints. Another is latex medicine. It is very important remedy for climatic. We have one rubric in repertory like patient is never well since after menopause. Latex is very helpful in here cases. Patient has melancholic disposition. Sensation of tension in various parts cannot be tight anything anywhere. Lady with great loquacity said in morning, better by perform at night. She has also religious incentive. Climatic troubles, palpitation, hot flushes, vertex, headache, fainting spells, meme, pulsatilum. Preeminently a female remedy for mild gentle yielding disposition is whips easily ameliorated by consolation. Pulsatilla is very much thirstless. Symptoms are ever changing. Person is emulated in open air, burning in urethra, involuntary menstruation, which is aggravated by coughing or passing flatus. Sleeplessness, numbness around elbow. This specific thing is in pulsatilla is like she sleeps with her hands overhead. Sanguinuria canadensis. Marked symptoms of sanguinuria is vasomotor symptoms like hot flushes, red cheeks, distension of veins, applicable to climatic disorders. Headache written at climatic every 7 days. Uterine polyp, soreness of breast, burning of palms and soles, compared to the bed clothes, compared to the throw of bed clothes. Painful enlargement of breast, and legacies and sulfur failed to relieve. Especially on total system of venous congestion, hot flushes at menopause with weakness and perspiration, easy fainting, cold sensation in inner parts, tubercular patient, brain reflux, tremulous feeling with flushes, malaise, pulling of hair at climate, sweat on feet, burst, toes, in intolerable body. These are other medicines like caladium. It has a very much particular symptoms of pruritus of vulva, which is voluptuous, calcarea ars, the complaints of fat, woman around climate, slightest emotion causing palpitation. Also a very good medicine for carcinoma of uterus. Clonide, excellent for the intracranial headache or due to menstrual suppression, climatic plus calcarea, fatigue without cause, muscular weakness, chilliness, weak bones, head climate. So now I will present a case of menopause with hypothyroidism. A woman, the name of Mrs. Meena Shah, 49 years of age, married woman. She is a teacher She has complained of hot flushes with excessive sweating since 2 years. Sudden waves of heat followed by profuse perspiration, which is aggravated at night and emulated by open air. Irregular menstrues progressing to amenorrhea, which is since 1.5 years, and her LMP was 12 January 2016. Initially, she has irregular and scanty menses. Now she has no menses. She has vaginal dryness during intercourse, also pain during intercourse because of that dryness. These symptoms is around 6 to 8 months. It causes burning also, which is ameliorated by rest. Another symptom is like anxiety with irritability. Also, it is since 2 years. Her mood changes are marked. She feels like a weeping very frequent and anxiety without any cause. And also amelioration by consolation and comfort. With that, she has sleeplessness because of constant thoughts in her mind during night. She has a bilateral knee pain since 1 year, which is aggravated by first motion and amelioration by rest. And pain is with stiffness. And she said that the pain is not regular. Sometimes it is there or sometimes it is absent. With pain, she has a feeling of crackling sounds in their joints. These are some history of present illness. The patient was apparently healthy until about 2 years ago, when menstruation gradually became irregular. Initially, cycles occurred every 40 to 60 days, with severe flow eventually stopping completely 10 months ago. Following menstrual irregularities, she developed sudden hot flushes associated with redness of face and profuse sweating. Episodes last few minutes to few hours. She complains of disturbed sleep due to night sweats. Mood has become increasingly irritable. She cries easily without obvious reason. She feels her family does not need her as much as now that both children are employed and living back away. She frequently experiences anxiety regarding aging and loss of femininity. Sexual intercourse has become painful because of vaginal dryness. Joint pains developed gradually over the last year. In past history, she had a typhoid fever at the. Okay, sir? Is it audible
Okay.
now?
Yes, audible.
Okay.
Little more.
Mental history of the patient. Patient is extremely responsible. She suppresses emotions to avoid disturbing family members. She feels neglected after children become independent. Frequently thinks she is useful. My usefulness is not there. Cannot tolerate contradiction. Becomes offended easily but rarely expresses anger. Weeps while narrating complaints and very affectionate toward family. She is very sympathetic. Needs consolation. Fear of growing old. Fear of being dependent. Anxiety of future of health. Cannot remain alone. Sensitive to criticism. Mood changes rapidly. Loss of confidence. She has reduced concentration and memory loss. She has weak memory for recent events. In physical generals, I considered her appetite, which is moderate. She cannot tolerate skipping meals. Her thirst is very much thirstless. She drinks approximately 1 liter per day. Her desire for sweets and ice cream and cold drinks are marked. She avers for fatty food. Because of that, she has some complaints of digestion, so she has aversion of fatty food. Thermal reaction. I asked about her thermals, so she said that I have much hot flushes and I can't tolerate warm weather. So she is a hot patient. In stool, she has no any major complaint. It is quite normal and regular and soft. The urine is normal and no burning is there. Her sleep is disturbed because of hot flushes and constant thoughts. Her perspiration is profuse and it stains yellow. So, the diagnosis of the case is non-case of hypothyroidism with perimenopausal symptoms. These are some classification of symptoms which we already discussed. In mental generals, I considered forsaken feeling, weeps easily, desire for consolation, anxiety about future, sensitive to criticism, fear of aging, affectionate, suppressed emotions, irritability before sleep. In physical general, patient is very much hot, fastless, hot flushes, desire for sweets, profuse perspiration, which stains yellow in the clothes, worse, warm room, better in open air, disturbed sleeps, and night sweats. In physical particulars, vaginal dryness, painful intercourse or dyspareunia, bilateral knee stiffness with changeable pain, crackling sounds during movement, which is aggravated by fast motion and amelioration by rest, irregular menses progressing to menopause, palpitation during hot flushes. I considered 10 preparatory for lubrication, where in mind section, these are some rubrics which I considered: 4-second feeling, weeping easily, consolation ameliorates, anxiety about future, sensitive criticism, fear aging, irritability. In generalities, heat flushes, warm room aggravates, open air ameliorates, perspiration is profuse, and climate-break complaints. In female section, I considered the rubric of menopause complaints, menses disease, and dryness of vagina, extremity, knee pains, stiffness, fast motion. This is the totality of symptoms, where 4-second feeling after children left home, weeping with desire for consolation, anxiety about future, sensitive emotionally, hot flushes, warm room aggravates, better in open air, fastlessness, profuse perspiration, vaginal dryness, menopausal complaints, and knee stiffness. So, according to the totality and lubrication, my final prescription was pulsatil at 200, instead dosed and also followed by Seclec by 4 by 2 by 15 days. And also I advise patient to do regular brisk walking, take a proper diet of calcium which is rich in calcium and vitamin, do some meditation for good sleep and start reading books at night. In follow-ups after 2 weeks, patient comes with mood swings little bit reduced. Hot flushes only at night, joint stiffness in morning as it is, and her sleep is improved. Menses is not appear now. First increase down, she take 8 to 10 glass of water, which is previously first place. So now I feel that there is no need of repetition of medicine. So I advised her to cycle by 4 by 2 by 15 days. And after 15 days follow-up, she had no complaint of hot flushes now, but sleeplessness reappeared. Some symptoms are reappeared, like but her thirst is improved. Knee pain is as it is, increased when taking oily food. Like she has some digestion issues now. Because of that, she has knee pain, as she described in that follow-up. Patient has mood swings, which is increasing now, and patient is not well, like first 10 days after starting medicine. Here I get a mixed picture where a patient gets some reliefs and some new symptoms. So I advise to her one state dose of pulsatil at 200 once again, and also give Seclec for 4 by 2 by 50. After 6 weeks, this time patient came with happy face and described her improvement happily. She said no hot flushes now, perspiration also in normal limits, and her joint pain still there but restorable, not much giving issue to her, and her mood swings significantly improved. So now I give her a Seclec for 1 month and advise to take proper food and supplements to maintain calcium and vitamin D3 levels. This is another case of menopause with migraine. A female patient named Rekha Patel, age of 55 years. She is a housewife. She has a complaint of hot flushes since 3 years, where intense heat rising upward with redness, which is aggravated at night, warm room, and she has a specific symptom like tight clothes aggravation. She cannot tolerate tight clothes at night or during sleep around her neck, and she epilodates during open air. She said that she wants to open her windows and door for a good amount of air. Another symptom is night sweat, which is since 2 years, where she feels profuse sweating during midnight, which causing her sleep fast. So she has a heat intolerance. She has a palpitation since 2 years, where rapid pounding of heartbeat. Also hot flush is there. Because of palpitation, sleeplessness also there, where she feels difficulty in falling asleep, wakes feeling worse. Also have morning headaches. Her headache is left-sided since 2 years and left temple extending to occiput, which is the location. In headaches, she feels throbbing type of headache with bursting pain, which is worse in heat, sunlight, after sleep, and which is ameliorated by pressure. Hot flush is also there. This is the history of present. The patient was well until 3 years ago, when menstrual cycle became irregular and gradually ceased. Soon after menopause, she developed frequent hot flushes beginning in the chest and rising to the face. Her face becomes dark red, followed by profuse sweating and a sensation of suffocation. She cannot tolerate tight collars, necklaces, scarves, or fitted clothing around the neck because they produce choking and discomfort. She reports that every morning after waking, she feels worse than before sleep. Headache and irritability are especially marked after sleeping. She becomes extremely talkative during emotional excitement and often jumps rapidly from one topic to another, which is more specific of legacy. Family members report that she has become suspicious and jealous without a clear reason. Her past history, she said that she has migraine around since 3 years and also have hypertension since 4 years, but it is in control and she is taking regular medicine of hypertension. In family history, her father has hypertension, her mother has type 2 diabetes mellitus. Here I also considered her mother's menopause age, which is 52 years. Her brother has hypertension and her sister is very much okay. I further asked about her mentals. So she said She and her relative said she is very intelligent and expressive. She always talks and often changing topics. Cannot tolerate contradiction. Jealous by nature. She had jealousy of her daughter-in-law, feels that she had all the attention and no one is there for me. Because when I take case, a patient said her son's marriage is before 1 year. Now she has a daughter-in-law, but since then she has a jealousy of her daughter-in-law. Much she have no much problem with her, but she feels like she get no attention from family now. Suspicions of others, intense, feels neglected by family, very passionate and ambitious. She always is a patient. She is a housewife, but she is always doing some activities in her society for encouraging everyone. So she is somewhat extrovert. Quick temper followed by remorse. Cannot bear tight clothing around the neck. Her symptoms become worse after sleep. Strong desire to dominate conversations. Fear of serious disease. Anxiety before menopause related medical visits. These are some physical generals. Patient has a very good appetite. She feels hungry at regular intervals. Her thirst is marked for cold water. Because of her hot flushes, she is emulation by cold water. Her desire for spicy food and cold drinks. She has aversion of milk. Because of milk, she gets some digestive issues, so she is not taking milk. Thermal reaction, as we know, in hot flushes, patient always get aggravated by warm weather, so patient is hot in stool, like occasional constipation, otherwise it is regular. Her urine is normal and a normal frequency, but sometimes she feels burning in urine. Her sleep is disturbed because of hot flushes and some thoughts. Her perspiration is profuse and very offensive perspiration. So my provisional diagnosis with this case is non-case of hypertension with migraine and menopause. Here are some rubrics which are considered from 10 referred. In mind section, rubric is jealous, suspicious, loquacity, irritability, contradiction, aggravates, generalities, complaints during climacteric, words after sleep, heat aggravates, open air ameliorates, clothing around neck is aggravates. In female section, menopausal complaints, hot flushes, dryness of vagina. In head, pain in left side, worse after sleep. Totality of symptoms. As we discussed all symptoms like menopausal hot flushes, worse after sleep, intolerance of tight clothing around the neck, left-sided headache. Much marked symptom I consider is jealous disposition, suspicious nature, loquacity, cannot tolerate contradiction, hot patient, better in open air, thirst for cold water, and palpitation during hot flushes. So my prescription for this patient is lacacies. I give her lacacies in one dose and followed by SL for 4 by 2 by days. I also advise to this patient regular brisk walking, calcium and vitamin D3 rich diets, do some meditation and yoga, and good, for good sleep, start reading books at night so she gets no any thoughts. In follow-ups, after 15 days, patient head pain little bit reduced, hot flushes only at night. Her sleep was very much improved, palpitations sometimes occur, not regularly. So patient said she feels overall 10 to 20% improved. So in this time, I give her a cyclic only, no any medicines. After 1 month, patient said she had no complaint of hot flushes now. Her sleep was also
Yes, Dr. Hans, we started. Yes,
Ah,
yes. Doctor, how many slides remaining?
Sir, I am done with my presentation. That was the last slide.
Okay.
She had no complaint of hot flushes now. So sleep and also sleeplessness improved around 30% and severe headaches in 2 days. Aggravation of headache because of some family dispute, and after that she feels too much anxiety and palpitation. So because of that acute aggravation, I give her Lacasins 1 dose again and Secalin. Thank you everyone.
Yes.
Thank you very much, Dr. Hardi Malani, for such an informative and enlightening presentation. You have beautifully explained that menopause is much more than hot flushes. Your discussion on the physical, emotional, and psychological changes midlife, along with the homeopathic approach, individualized patient care, has certainly enriched our understanding. We sincerely appreciate your valuable time and effort. Now we will move to the interactive session. I request to all the participants who have any questions or clinical experience to kindly raise their hand or post their questions in the chat box. We will take them one by one.
Yes, since only few minutes remaining, we can have only just 6 minutes more. So we can have a short discussion, as rightly pointed by Dr. Ringal Advaya. And yeah, definitely, Doctor, it was a very good session. And reaching the civil in a different way is always good. And after giving the medicine, it works for you. And that's the reason why you're able to come up with the base presentation. Thank you. Over to Dr. Manoj.
thank you, Dr. Tanesh. Congratulations, Dr. Hardi Malani. Have done a good job. I think what is more important is some concentrated effort on this way, because this is a major problem majority of the ladies are facing, and in fact there is no other options than homeopathy. Like giving the hormone tablets is a non option. So with homeopathy, we can give a solace to this burning problem, I think. But what is the problem is that we are lacking such specialist courses. Everybody is well aware of this. They have enough medicines in therapeutics, but don't have the accepted course. So what is needed is some super specialty courses are there. So there, thus we can have some experts to give some opinion as well as to guide the others also. Congratulations, your endeavors. Thank you.
Dr. Ringal, we can invite before process Andre sir.
Thank you, sir. Uh, am I audible?
Yes, yes, sir.
Actually, she has presented 3 cases, and symptomatic treatment was done, and she got the result. Actually, all the menopausal or mood swing, that is because of the estrogen deficiency. So, when the estrogen, the main hormone, decreases, the secretion decreases, then the side effect occurs. So because of that side effect, mainly the vasomotor symptoms we are getting, that is hot flashes, then night sweats, palpitation, flushing of face and neck, sleep disturbances. These are the common symptoms of mood swing. So these symptoms, this symptom we considered, and accordingly we are selecting the medicine. And certain psychological symptom also occurs, that is anxiety, depression, mood swing, irritability, poor concentration, then memory impairment. So some lady they cannot adapt it, and because of that they may commit. There is tendency develop, that is suicidal tendency. So that suicidal tendency can be removed by prescribing antisyphilitic medicine like aurum metallicum, aurum group of medicines. Then other genitourinary symptoms which appears during menopause because of the decreased secretion of estrogen, that is vaginal dryness, dyspareunia, then burning and itching, recurrent urinary tract infection, urgency and frequency of urination, stress, urinary incontinence. So these symptoms can be treated successfully by homeopathy, as Monosar told. We have so many medicines are there, whereas in conventional medicine there is no treatment. So for example, dryness of vagina, we can prescribe natriumur and sepia, then graphitis. So there are so medicine, but the symptom must be characteristic. We should not consider more to the common symptom. We have to consider the uncommon symptom and history. Then the mechanism that occurs because of the atrophy of vaginal epithelium and urethral mucosa due to reduced estrogen. Then mucoskeletal changes. Mucoskeletal changes are very important. Actually, after menopause, what happens? It leads to, because of decreased secretion of estrogen, there is osteoporosis. So ladies suffer from osteoporosis after menopause. So to prevent osteoporosis, the medicine like calcarea-phos, like calcarea-fluor, and because we know for formation of bones, phosphate is essential, calcium and phosphate. So supplement of calcium and phosphate can be given along with your selected medicine. Then your joint pains. So joint pain, in most of the cases joint pains also appear. So for joint pains, again after menopause, the menopausal medicine like lachesis, like graphitis, like natriumur, like glunine. So these medicine can be selected on the basis of symptom totality. Then muscle weakness occurs. So to get relief from the muscle weakness, exercise and lifestyle should be changed. Then certain cardiovascular effect also occurs because of decrease of estrogen. That is increased level of LDL or cholesterol, reduced HDL. So good cholesterol reduced. So it leads to hypertension, arteriosclerosis. So these changes, vascular changes, it appears after post. These are the post-menopausal effects. So that post-menopausal effect must be treated properly. Second thing,
Sir, sir, our time is already over.
increased risk of coronary artery diseases occurs after menopause. So we should take care of those post-menopausal problems, and it can be clearly managed by our selected homeopathic medicine. Thank you very much.
Thank you, sir. Over to Dr. Ringal Adaya to conclude the session.
Yes, sir. As we conclude today's webinar, I would like to express my heartfelt gratitude to our speaker, Dr. Hardi Malani, for sharing her valuable knowledge and clinical experience. I also thank the founders, coordinators, and the entire IFPH team for their relentless efforts in successfully conducting this uninterrupted daily educational initiative. A special thanks to all the participants for your active presence and enthusiastic participation. Please continue supporting IFPH by attending a future webinars, subscribing the IFPH YouTube channel, and sharing this educational session with fellow homeopaths. Stay connected, keep learning, and keep promoting homeopathy. Thank you all. Have a wonderful evening.
Thank you. Thank you, Dr. Ringal Adaya. It's over to Dr. P. Shaila to moderate the Malayalam session.